And I'll continue admitting people, but Tom, we'll go ahead and get started.
Well, Joe, you can, well, first of all, welcome everyone, but Joe, you can see who's there. So if you would, we'll let people introduce themselves. We haven't been together for a while. And,
Yeah, that's
and so, but you can call out the names because, or the people because I can't see them all.
okay. Give me 1 second here. I want to share my screen with everybody so you can see the agenda. I also included the agenda on the invite that I sent out. And I'm using a new invite service called S'more, newsletter service called S'more. And the reason why I went for that is S'more has some built-in functionality for translation services. And the other thing that I did this month, just so that you could see it, is, oops, let me start the recording here. Oh, we are recording. The other thing that I did this month is I included most of the program business updates in the body of the invitation email. So you can refer back to that to know where we are with different phases of program implementation. And we can just focus on the most pressing business at hand. And so, okay, I'm going to share my, I have shared the screen. So the agenda today is pretty simple. We're going to start with welcome and introductions. We have Rachel Adams from the City of Monroe here to present on the Community Human Services Needs Assessment findings. We'll do very, very brief business updates just focused on the annual community survey and the coalition assessment tool. And then I'm going to hand it off to you guys. Carolyn, I'm wondering, since we actually have you on with us, if I can give you some time at the start of the agenda just to share what you're up to and what you're up against, and maybe talk about how the coalition can support your initiatives. We are always indebted to you. You have championed a participant. Oh, yes, let me enable live transcriptioning. You've been an incredible champion for the region, for youth mental health, for school-based services. And so just a pleasure to have you on here. So I'm going to do introductions, and then I'm going to hand it off to you to get us started, Carolyn. Thank you again for being here. So if you are on the screen with me, does everybody know how to raise their hand? If you go to reactions, oops, I don't even have that now. That's funny. Yes, if you know how to raise your hand, please raise your hand for me. If you did raise your hand, will somebody tell us how you did that? Because I don't have.
You're right, Joe. If you go to reactions, it's like on the very bottom of the reactions.
Okay, and then what's going to happen is I will call on people whose hand is raised. So you might have given me the thumbs up or a heart symbol, but try to raise your hand. And so, Amber, you're first on my screen. Would you introduce yourself?
I am Amber Mehta, and I work for the Monroe School District. I am the truancy specialist for the district.
Thank you. Lorena Lee, I see you next.
Hi there, I'm Lorena Lee. I am the student support advocate at Frank Wagner Elementary School.
And Stephanie Phillips, you're next up.
Hi, I am Stephanie Phillips. I'm the student assistance professional at Monroe High School.
Thanks for being here, Stephanie. And Pastor Michael Hanford, nice to see you.
You too. Michael Hanford, I'm a police chaplain for 24 years and fire. I'm the coordinator for Monroe Pastors Fellowship and on the leadership team of the coalition with Joe and a few other things, and good to be with you.
Thank you. Mr. Jury, so good to see you.
Hi, everyone. I'm Chris Jury. I'm the prevention manager for the Northwest ESD and getting around a little bit.
Getting around. My friend Wendy Burchell, how are you?
Hi, Joe. Wendy Burchell from the Snohomish Health District, Healthy Community Specialist, focusing on injury prevention, which includes youth suicide prevention and safe sleep education in the community for babies. And I'm here, we're gonna rotate now, Snohomish Health District folks. So you're used to seeing Juliet here, so we're gonna kind of rotate so we can all be involved with all the coalitions. So I'm glad to be back. I was pretty active a few years ago, so it's good to be back.
Wendy, I'm so happy to see you.
Yeah.
Sharon, welcome. This is your first meeting.
Yeah, it is. Thanks for having me. My name's Sharon Lineweber. I'm a new counselor here at Park Place Middle School.
And if you saw the invitation email, I mentioned that our 2 Park Place school counselors will be trained next month in the coping and support training program. Sharon is one of our 2. So she will be delivering coalition programs for us. Really excited. Sarah Johnson, congratulations and welcome.
Thank you so much. So yes, the election will be certified on Tuesday, the 23rd. So I'm currently in the lead and hopeful for the work that I get to do, hopefully get to do on the Monroe School Board. I also have 2 kiddos in the district who attend Maltby Elementary. And then in my day job, I am a vocational rehabilitation counselor. And thanks for having me here.
Thanks for being here. Brittany, you're up next.
Good afternoon, everyone. My name is Brittany. I am checking in from the Snohomish Health District as well. Here at the Snohomish Health District, I am a healthy community specialist, where my focus is youth, marijuana, and tobacco prevention. And thank you for having me once again. Great to see you all once again. Thank you.
Thank you. Derek Slocum, I don't recognize your name. Is this your first meeting?
This is my first meeting. I am the Teen and Youth Director at the YMCA here in Monroe. So I was recommended to join this meeting, and so here I am. Very glad to be here.
Welcome. We're so glad to have you. And an old friend, Mary Beth Darst, has returned. Mary Beth, you're up.
Hey, I am Mary Beth, and I am the Child and Family Specialist for East County for all of our Housing Hope properties.
Wonderful. Thanks for joining us. Kimberly Clem, I see you're next.
Hi, everybody. Can you see me or hear me?
Yeah.
Okay. Kimberly from Cascade Community Church. I'm the Community Care Director.
Welcome. Welcome.
Thank you.
Kristen, thanks for joining us this month.
Thank you. Kristen McCauley, Case Manager at CMAR Behavioral Health.
Thank you so much for being here. Julie from Compassionate Friends, welcome.
Thank you for having me. I am with the Compassionate Friends of Snohomish County, serving bereaved parents, siblings, and grandparents after the death of a child. And that child can be from the unborn, up to an adult child. The loss can be anything from suicide, overdose, homicide, accidental. I am a bereaved mother. I lost my 18-year-old son 17 years ago, giving back to an organization that saved me, and just trying to get the word out to anybody that's faced with devastation, therapists, highway patrol, police, fire department, massage therapists. Just here to get the word out because I know there's someone sitting home isolating and doesn't know this support is out there. So thank you for having me.
We're so glad you could join us, Julie.
Thank you. And new to Monroe, our chapter of the Compassionate Friends, we started in October of last year. I led the Kirkland chapter for over 10 years, relocated to Monroe 5 years ago, and saw the need in the bereaved community.
Wonderful.
So thank you. Thank you for having me.
Yes. Savannah Butcher, you're up next. Welcome.
Hi, my name is Savannah and I work with Big Brothers Big Sisters of Snohomish County.
Thank you. We're so glad you're here. Aubrey, I see you're next.
Hi, Aubrey Rudd. I am with the Church of Jesus Christ of Latter-day Saints and also a mom of 3 kids in the Monroe School District. So I'm glad to be here.
Thank you. Thank you. Kathy Jackson.
Hi, good afternoon. I'm Kathy Jackson. I'm the Family Engagement Liaison for the district, and I support our elementary and our middle schools.
Wonderful. Thank you. Rachel Adams, you're up. Who are you?
Hi, I'm Rachel Adams. I am a project management consultant with the City of Monroe and the Human Services Specialist.
Thank you for being here. Craig Robertson, I see you.
Hi there. I'm here and I'm sorry I'm distracted quite a bit. I have a window that shows me all the students that walk by since I'm at the high school. So as they go by, I might wave and you might see me waving. I promised it's at the kids and I'm not trying to get all of your attention. Officer Craig Robertson, I'm the school resource officer for the school district. And I'm up at the high school primarily and travel around to all the schools wherever I'm in need. And I just want to know how Tom background that it makes it look like camping in a log cabin because I want that. So however he got there.
Well, you know, the next meeting is going to be at Tom's house. So
right, got it.
There we go.
Sherry, we're so glad you could join us. How are you?
I'm well, glad to be here today. I'm Sherry Matthias. I'm on the Monroe Community Coalition leadership team. I have 2 children in the Monroe High School and also from the Church of Jesus Christ of Latter-day Saints.
Wonderful. And last, but certainly not least, Representative Carolyn Eslick. Thanks for being here today.
Thanks for the invitation. It is my pleasure to be here. I just really like this venue of all of these folks that are working in the same field that I'm working in, but of course at different levels. So most of you know that last year my my bill for identifying family resource centers, the description of what it is now in statute, and that was our first step in order to get them the recognition that they all have deserved. It's been a process, and it's really taken me since 2017 to get to this time, this position. But you know, good things end with good notes. And actually, I find it is not the ending; it's just the beginning, because now we're forming a network. And in order to form that network of family resource centers and find the folks that are doing the work already that maybe don't even know their family resource centers, that network organization has to be implemented. And the Children's Home Society has found funding for us to put that plan together. So that's a huge step for us. I'm also going to the legislature this year and asking for funds to go specifically to family resource centers because we know that the behavioral health field we absolutely have got to get more providers and more counselors in our communities and neighborhoods. So that's kind of where I'm at right now in that particular arena. But I sit on the Children's, Youth and Family Committee, also the Children's Mental Health Committee, and there was a and still is a subcommittee of that is for the youth mental health, and we nicknamed it the YAC Committee. So we have come up with priorities on what, after many meetings and after bringing a youth on board that has had youth experiences, come up with some proposed needs that are the youth need. And we added them to the Children's, Family and Youth priority list. I will go over some of them with you. This is a combination of all the children, youth and family priorities. One that, you know, I don't know if you folks know, but there was a pilot program called the Warm Line, and it's a telephone line. I see Sarah shaking her head. So we are asking to make this a permanent project so that so mothers and fathers that are having first children can have access to a professional to ask questions. So that's one of them. We are asking for 100 behavioral health clinicians in our schools. So there will be, hopefully, that will be something that our schools can apply for and get that funding for. We are also asking for to fund a parent portal with a toolkit. And I'm not going to zero down on these items because that would take way too long, but it's for the parents of our mental health children and behavioral health children to have access to the services that they need. We're also asking for stable housing and a care coordinator for the youth that are exiting the treatment centers because they are having a bumpy ride. We've heard today, specifically, we heard some terrible stories of what has happened once they get out and there's not a soft landing for them and permanent housing for them. We're also asking for reimbursement for non-licensed staff that are coming in to help out. And they actually have, you know, they have a purpose and yet they are not getting compensated. So we're asking for stipends for them. We are asking to create a clinical supervision work group. We are, I specifically ask for a position at the Healthcare Authority that a full-time employee would be educating the public and the providers on new and old behavioral health and mental health laws. We have implemented several since I've been in office. And when I have my family call me and say, I'm at the ER and they say that I'm not allowed in with my child, the doctors don't know what the laws are today. And so my point is, when I realized coming into this position, is that we are really good about making new laws, but we are terrible about educating the public and the providers of what they are, so that we get immediate relief for our families. You know, so that's my contribution, I think, to the to this whole arena of families that are dealing with behavioral health issues and their children. I have a good friend that has been an advocate for youth for years, and she came to me last summer and she said, you know, I just feel like my words are not being heard. I feel like anything that I have to say about ideas to fix these problems, nobody's listening to. And she said, what we really need to help our families is a place where they can come online and talk to each other. And I said, well, and I'm going to warn you all, Joe knows this, don't come to me without an idea, because I will make you chair of that idea. So she started, oh sure, now I forgot, a Facebook page called Healthy Minds, Healthy Futures. So I give you that on a platform to tell your families that are dealing with these kinds of issues and that need somebody to talk to in the same position, to join that group. Healthy Mind, Healthy Futures. She also holds a Zoom meeting once a week so that people can actually talk in person on Zoom, but the Facebook page is open all the time, of course. It's done some really great things lately. So that's kind of, you know, the world that I have been working on the last few. I will touch on a Senate Bill 5720. Was there any of you on that on the committee this morning at 8 o'clock when the Healthcare Authority gave us an update on that bill? So what that bill does, and we implemented it, we didn't implement it. It came out in 2020 by the Senate to the House. And what it does is relieve some of the restrictions so that we can involuntarily commit people easier that are in desperate need. And for instance, the people that are out on the street that I see 10 years later are still there because we have not been able to get them the help by involuntarily committing them to a bed and stabilizing them. So 5720 will do that. But when it came over to the House, it was stopped because Rep. Cody knew we didn't have the beds. We could pull all these folks in that were mentally ill on the streets, but we didn't have a place to put them. So we funded many beds. And the question with 5720 was, how many beds do we have today? And how soon can we implement 5720? So the Healthcare Authority had told us this morning that we funded 356 beds to be completed by 2023. At this moment, we only have 106, let me just see, 104 beds that are open since 2020. And we're looking for more, 252. And you know, we find that that a great place to handle these beds is in hospitals. If hospitals will designate up to 16 or even more beds for psych ward, then everything that they need is already right there in one spot. And so we've been talking to Monroe. They're, you know, working on the idea, and Skagit is already there. So we absolutely have got to get these folks their help. And then, of course, Joe's probably heard me talk about this, but then we need permanent supportive housing in our own communities so that we can house these folks, because these parents that are raising the children in behavioral health issues now are someday going to need a place for them to live in their own community with the integrity and the honor that they need to be living in. And so that's kind of where I'm at, and look forward to some good things happening this year at the state level. We only have 2 months. It's a short session. It's because it's not a budget year. And so we are looking at probably Zooming again, much to my dismay, rather be in person, but we of course want to be safe. So that's it. So for you folks that don't know, that when you're a state representative, doesn't mean you're in Olympia 12 months out of the year. You're only in Olympia when you are in session. So that's your government lesson for the day. Any questions? No.
Well, Carolyn, I'm wondering how we can support you.
You asked that. I don't have an answer for you at this moment.
Okay.
I have encouraged our family resource centers to put together an op-ed piece about family resource centers and the success rate. And if anybody has any success stories that they want to include in our op-ed, they certainly send them to me. And we'll see about adding them to that. We're trying to elevate, because our life is all about prevention. And thank goodness, after all these years, we are getting that and understanding that, to be able to support that family before any crisis happens. That's what we need. Thanks, Joe.
Thank you.
I have a quick question for you. Where is like the nearest, so a family wants to access this resource center, how do they do it?
So where are you? What city are you in? What town are you in?
Monroe.
Oh, Monroe. So a step above is doing the work as family resource centers. They are fabulous. And Snohomish County just identified them as a family resource center, a step above.
Take the next step.
Oh, I'm sorry. Take the next step. Thank you, Joe. Where did I get that? Anyway, and then of course the Sky Valley Resource Center here in Sultan, and Marysville's got them, Arlington's got one, and we hope that we'll be able to open many more in the state, because every community needs a family resource center.
And
Did I answer your question?
Yes, thank you so much.
To that point, Aubrey, what Representative Eslick has done by getting Take the Next Step recognized as a family resource center is given them the opportunity to bring much more resources into the community to serve vulnerable families. So this was a critical piece of work that Representative Eslick helped to lead, and it's going to benefit us directly.
That's awesome. It sounds like, at least from what I knew from Take the Next Step, it was homeless families. It sounds like there's a mental health piece here that is come into place. That
Well, and so this is what it is for a family resource center, and it's open. The doors are open for anybody for any reason. They might not house a counselor there, but they will have that partnership so that they can connect the people to the services they need.
Yeah. That's awesome. Thank you.
Mm-hmm.
Any other questions for Representative Eslick while we have her? Okay.
I'm going to stay on a while, Joe. I'm going to stay on a while because I want to hear what you guys are up to.
Great.
Because I might want to advertise you too. You know.
You got it.
Yeah.
So
and I want to
hand it off. Oh,
I want to thank you, Representative, for just that was a great report and a lot of stuff going on. I did, you know, I've been retired. I'm off the school board. I'm off, so I don't have my ear to the ground anymore. And so it was just you're doing some great work, it sounds like. And you know, it's interesting. One of the things we found with our community coalition is we tend to be ahead of the curve, and some of the things that become issues, we saw them coming, you know, and that's the important part of a resource center as well. You get a picture of what's actually going on, and not just. So thank you so much for the way you're representing us at the state. Thank you.
Thank you. Thank you. That's very kind.
I'm still trying to figure out how to get my hand up.
Oh, Tom, I didn't ask you to introduce yourself, did I?
Oh, I just did. I haven't. I missed that tutorial or something. So anyway,
Couldn't get his hand up.
Well, I want to congratulate Sarah Johnson on her new position on the board, and was on the school board for about 17 years, and I'm real glad it's you right now, and not me. I would think it would be a very challenging time with the third, you know, all of the COVID. Good luck, and thank you for stepping up and filling in this very important role in our community. Thank you.
Thank you so much.
So I'm going to hand this off to Rachel Adams. Rachel, do you need me to share to give you co-host ability?
Yeah, that'd be great. Thank you.
Okay, but it's going to cost you.
Okay.
Let me do that. Give me 1 second. Participants. Oh, it's not letting me click you. Okay, technical difficulties here.
I can always share without the slides too, if that is.
Why don't you introduce your topic while I try to understand why this is not working?
Yeah, for sure. So again, I'm Rachel Adams. I'm a project management consultant and the human services specialist with the city of Monroe. And earlier this year, the city hired a consultant to perform a community needs assessment and facilitated program development. And that was the result of a recommendation from our Community Human Services Advisory Board and our team of Monroe technical experts, subject matter experts. So the city's role throughout this engagement was to function as a convener and just kind of pull everybody together. The city's not a funder or a direct service provider. And the goal of this study was to identify the human services needs and resources in the Sky Valley area. The study was conducted due to our explosive growth and just some of the displacement issues that we've been having around affordable housing and homelessness in the area. And the study map results were broken down into 3 distinct regions. So they identified kind of a central Sky Valley, which was Monroe and Sultan, and then an east Sky Valley, which was Gold Bar and Index, and then Snohomish, which was kind of connected to Everett in a way. So the project launched in May, and the secondary research was comparing all of the public available data. And then our phase 3 was where the primary research was conducted, and that's where the consultants engaged directly with our Sky Valley residents and our service providers and nonprofits to find out and really just make those relationships and talk to them about what the needs were that they were seeing in the community. And then phase 4 was the data analysis, and 5 has been to share this information out with our key stakeholders, which is all of you guys. But going back to phase 3 was where the most crucial phase ended up happening, and the consultants were able to have 353 touches with our community. And that number is broken into 45 key informant interviews, 26 provider surveys that were completed, and the goal was to have 220 resident surveys, but they actually got 226, so they oversampled slightly. And those who participated in the resident survey, their demographics really matched the area demographics for the type of people that we see in the Sky Valley. So they were able to sample from our Latinx group, and we had 2 community forums, and 1 was conducted in Spanish. So when the consultants looked at a 360-degree view of our area, they found that the percentage came really close to being the same as the estimated number in the Sky Valley. Then they also were able to sample from homelessness. They got a lot of participation from our abled and disabled community and from the LGBTQI+, which are historically underreported groups. And the last 2 that they were able to speak with were our mental health and BIPOC communities. All right, so for findings.
Rachel, you should be able to share now.
Oh, okay, great. Let me pull that slide up. You might be here. So yeah, this is what I was talking about the regions that they found as far as West Sky Valley, Central Sky Valley, and East Sky Valley. And I'm just going to jump down here and dive into the findings. So the number 1 finding was that they noticed that the consultants identified big gaps in this area as far as mental health, and that this was obvious that mental health is the number 1 barrier and gap by far with our survey. This service was also really Exacerbated, sorry, I have been struggling with that word lately for some reason, and stress during the COVID-19 pandemic. And currently we have one provider with limited capacity and two basic entry-level services of counseling and case management are pretty much non-existent for people other than the commercially insured. A major provider that integrated our homeless population in mental health left the Sky Valley area in June of 2020. And this is one of the major findings that they had about mental health. The other was that we have a population group, the abled and disabled, that were more than twice the population of the national or states. This population group, or oh my gosh, I'm sorry, I lost my place. So the physically disabled, independent living, hearing, vision, emotionally, and cognitive was by far the largest group. Okay, but now this is, I'm so sorry. So mental health is which pairs with the other group in many cases. This is where, I think I'm on the wrong slide, honestly. I think that's why I'm getting confused with my notes. Sorry, there we go. Okay. So mental health, which pairs with the other groups in many other cases, this is the autistic and borderline, somewhere on the autism spectrum disorder. And this is what can be both in children and adults. The current service profile is respite care only. There isn't really physical or educational. Certainly there was supported employment provider, which is really key for these individuals, whether autistic or disabled, but they also exited the Sky Valley in 2020. On the next level of services that are present, but not meeting the demands due to limited capacity, there were three. Housing supported, especially on the entry level of emergency shelters and temporary housing. Sky Valley is a cost burdened area for housing, and there are issues at all income levels with this particular service. Childcare before and after school, they found that there were limited hours with affordability. And another service that was stressed by the COVID-19 pandemic was childcare. Another service that they found was physical health is an issue of critical staffing shortages, and not just at the higher levels of doctors and nurses, but also at the frontline levels of MAs and billing clerks and receptionists. Many of them talked about different programs to give full scholarships and salaries to medical assistants, and would be able to commit services in the Sky Valley area. The local hospital recently has downsized the critical care unit due to staffing. The consultants identified that a partnership needs to develop between the local community colleges and PMA to support that staffing need in the area. Transportation was another thing that showed up. People regularly need to travel to Everett or Kirkland or for the disabled population, a lot of them were traveling to Seattle. And a constant regional referral pattern there needs to exist. So the needs to be more centralized to transportation navigation services. And finally, substance abuse is where there's a full spectrum of services, but in Monroe, but we also have issues with insurance acceptance and from particularly Medicaid and Medicare. Okay, now that I know where I'm at in my slides. So mental health was by far the #1 barrier and gap. The reasons were ranked and then divided by the 3 regions. They were also ranked by urban versus rural and by disproportionate populations. East #1, each #1 was, the #1 was transportation and then mental health for our East region. Clearly, there is an inadequate number of providers in the Sky Valley area. There are few mental health providers for uninsured or underinsured. And from the focus groups, we heard about people who were accessing services more in the Kirkland and Everett area. Yeah, I have a question in the chat. Oh, yes, yes, you can. So housing, not by any surprise, was our #2 barrier and gap. From the socioeconomic profile, this is a technically cost burden area with 32% of income going towards housing, which is higher than the national average. The entry-level services for the housing continuum, shelter, temporary housing, and housing supports, affordable housing markets, rate housing. And this was interesting because they were seeing this as a need throughout all income levels, as I said earlier. And it was defined differently by all income levels too. The Latinx group defined wanting safe and affordable housing. Our seniors were concerned about maintenance and upkeep and being able to downsize. The homeless didn't have housing, and the youth group that they surveyed were concerned about being kicked out of their housing for being LGBTQ. And a high percentage of residents reported being chronically homeless. So substance abuse and mental health are different, even though some have co-occurring disorders. And we have the consultants found was that we have a fairly robust continuum, but the struggle here was with insurance and reimbursement, especially through Apple Care and Medicare or Medicaid. Transportation and childcare was one of the big victims of population growth. The need for more evening and weekend options. Transportation was different things, again, to different people. It was more of a request for navigation, like how am I going to get where I need to go? A specific need was for the abled and disabled population. Transportation support, a number of agencies offer this, but there was no one centralized location. And physical health, again, was a big surprise. There were a number of providers, but there's just a really difficult staffing issue here. Disabled talked about their therapies. Latinx talked about affordable primary care and prenatal care. And seniors talked about services that they needed but weren't always available. About primary care and dental services, and youth and LGBTQ talked about specialty care and hormone therapy for the transgender. Having a partnership with the community colleges and a track to help with staffing was their recommendation in this area. So some of the surprises that they found were that our abled and disabled population was a very high percentage, and that they had no services here except for respite care. Second surprise was homeless housing being an impact in every level of the Sky Valley area. And then access to physical health being that burning issue of staffing. Great. So I have now gotten to my questions slide, and I can go ahead and try and answer any questions. Go ahead and stop sharing so I can see all of you too.
So this isn't really a question. Kristen McCauley here, case manager at Seymour Behavioral Health in Monroe. We do offer substance use and mental health. Our substance use program is empty. We are trying to fill it. We do only accept Medicaid, unfortunately. That is a positive for a lot of our low income clients. We are currently seeking like a office space in Sultan, or a place that we can just send one of our clinicians for substance use in Sultan, because I know another barrier is those that are out further, Gold Bar and stuff like that. So we're currently looking for a space. We're hoping to partner with somebody, and maybe they'll allow us to come into their office and use it for once a week. Our mental health side here in Monroe is full. We're booked out till January. We do put clients on our wait list. So if we have a no-show that day for an intake, we'll call the people on the intake on the wait list to try and get them in sooner. But I just wanted to say that.
That's so wonderful. Thank you.
Yeah, no problem.
I think you may have been our one remaining mental health provider.
Yeah,
that came up in the survey.
Well, we're here.
I think you might have been it.
Oh, okay.
So, and I honestly didn't know that that you accepted Medicaid there. Thank you. That's been a really big need in our community. So,
yeah, that's pretty much all we accept. Sometimes we'll do private pay, or we'll do like a sliding scale. Well, where if they bring in their income, we can kind of match what they're making if they don't qualify for Medicaid.
That's wonderful. Now, do you do medically assisted treatment for
We do.
substance? Okay. And do you do inpatient services there?
So we are an outpatient facility, but I coordinate. I actually do the coordination of inpatient. So if someone comes in for substance use, they get an assessment and the recommendation is inpatient, I will go ahead and coordinate that for them.
Great. Where do they end up? Where do you end up referring mainly?
It all depends based on their assessment, what kind of medications they're taking, if mental health is a factor, if it's long-term, short-term, but there is a number of them. There's Seymour Tacoma, Turning Point, PCN, JOTC, Over the Mountains, Sundown. So there's quite a few. I have a list that accepts Medicaid.
Wonderful. Good. Thank you.
Yeah, no problem.
Any other questions for Rachel? I can tell you that I had great interest in hearing the report today, primarily because the coalition's programs, school-based programs, are pretty much set. And so where a lot of the obstacles over the last half decade were just about getting our programs in front of all kids. Now that that's set, we're kind of at a point in our journey where we have to decide how we can best serve the community. So with one size fits all programs hitting all students K through 12, and then specialized programs supporting kids who are falling through the cracks, and then one-on-one services that we put in place supporting kids who fall through the cracks even further. I think what's left is, how do we coordinate around the true needs of the community? Because the long-term direct service prevention strategies are in place for now. And so how do we use Rachel's work and the work of the city, Carolyn's work and the work of the legislature to really start identifying and responding to our systemic needs in the community? What does it look like for an organization like ours to start to recruit and promote mental health expansion in Sky Valley? We know it's a need. What does it look like if we support Pastor Michael and Chris Gray and Tom and Mary Beth with their housing needs, right? Because we know all of these are risk factors for continued engagement in substance abuse. So that's really was my motivation in asking Representative Eslick and Rachel to present to us today. We're ready to take the next step. We really are ready to take the next step. And so I'll open the floor if anybody has any thoughts. I need to put out there that what's happening on my monitor right now is every facilitator's worst nightmare. I don't even know what I'm looking at. I can see a couple of your pictures. I can't interact with Zoom in any way, so I couldn't mute myself. I can't admit new people into the meeting. So unless I close all this down, I'm just committed to going forward with what I can see and do. So I'm asking for you guys to bail me out and take a greater leadership role here. Before we move on from Rachel, any thoughts or recommendations or requests or ideas? Now's the time.
Rachel, I have about if, you know, we all know that internet and technology access was a big topic through the pandemic. And is that something that came up in looking at mental health services, in you know, working with the Department of Labor and Industries, getting mental health services for injured workers? We have shifted a lot of referrals to remote services. It has been probably the best way for us to actually get services for people. And I'm curious if that came up anywhere in the survey results or in conversations happening.
As far as telehealth, yeah, that was not, I don't think, something that they looked at as far as like a service that they had here, we have here localized in Monroe. I know that that is a service option that especially I think Compass Health has transitioned to really well and is kind of leading the way in that for our families here. But yeah, that is, I think one of the other issues in mental health has been staffing. It's been just really hard to find clinicians and then also to get families appointments.
Yeah, there seems to be in sort of central Washington, like Yakima area, there are quite a few providers there who have open availability for these for telehealth appointments. And so, you know, in situations where we've been able to get people access to the technology that they need, it's been a useful option.
Yeah, it's
not
interesting.
Ideal. Not ideal,
Yeah.
right? But an option still.
But I mean, if it's consistent care and you're able to develop a relationship with somebody, you know, even on telehealth, I think that, you know, it can function pretty much the same way.
Yeah. Thank you.
Thank you.
Any other thoughts or questions for Rachel? Okay, I can't share my screen with you guys. Rachel, thank you so much. I feel like we're getting a more and more complete picture about both what our needs are in the community and what our legislators are doing to help us address them locally. And I think it's building toward our own strategic plan, which will be due in June, on June 15th, and how we'll start planning to support the community in light of all of this information and effort. So it's an exciting time. I was going to share my screen with you, but cannot, just to give two updates. One is we are up to 651 responses to our annual community survey of adults. It is broadly representative, except in one area. We are under we're getting fewer participants than we need from our Latinx population. So only 35 respondents. Otherwise, what I would show you is that about 4% of respondents have identified as being multiracial, 1% Native American, 3% Asian, 2% Pacific Islander, about 1% Black, 80% white, 6% Hispanic, primarily female respondents, 68% female, a great distribution across education levels. So I think I'm going to put out one more attempt to recruit our Spanish-speaking population to share their insight on this survey. I'll resend the link out to you. The other survey I needed to make you aware of is every year in the winter, we are required to survey coalition members on how the coalition is functioning. This is called the Coalition Assessment Tool, or the CAT survey. And I had a funny cat Titanic graphic that I like to share, but just take my word for it. It's adorable. But that will be coming to you. And so what I wanted to caution you about really is two things. If you have been to 3 or more meetings, I really need you to complete the survey so that we can be compliant with our funders' expectations. And please know that this is not an anonymous survey. I have to tie your responses to your participant profile in our state management information system to verify that you're actual living members of the coalition and not figments of my imagination. What that does, though, is it puts you in a position to give potentially critical information, both about the coalition and about my performance in serving you directly to me. And I never follow up, or, I hope that nobody's felt like I've carried your feedback in any other direction than how we can uplift the coalition and continue to improve our effort in coming together. So please don't temper your responses. Tell me the truth. Even if it does hurt my feelings, I won't tell you about it. No. But we use this every year, especially on the leadership team, to enhance what we're doing and to focus in our efforts. So I will be sending that to you by tomorrow afternoon. Please, if you're on today, fill it out. It's ridiculously long, but it's a requirement to continue to receive funding. So just wanted to put that out there. Otherwise, I am no longer able to call on people because I can't see everybody. What I was hoping is that we could hear from each of you. Tom mentioned earlier, like how nice it is to get our fingers on the pulse of the community, to hear what's really happening on the ground. And this is where we do our best effort at coordinating, just hearing directly from you, what you need, how we can support you. I can't see if Craig is on the line with us, but I'd love to start with a law enforcement report. Craig, if you're still with us, what are you seeing at Monroe High School? What are you seeing in the community? What's going on?
Well, I see a bunch of kids that are wanting to get out of here thinking it's Friday, but it's not. So that's what I do see. So I appreciate you having me go first so that I can bounce off of here. And I don't need to do that, but I like to be out there when the masses go running out of the school. What do I see in the community? Well, I'll be honest with you. I've been really scratching my head, but man, physically and literally and everything. I really have been really thinking about what I could do. I think we're all fully aware of what happened this last week, which I can't really discuss in any sort of detail. It's never easy to watch or look at or even be a part of, but it's still under investigation. We're going to leave it alone on the police department side, but there's a bit of a divide up here when it comes to students. And that is not the norm. Although social media might say otherwise, it is not. And from what I'm seeing and the students I'm talking to, it is not acceptable. And we have treated it, and we treated it very serious. And I've been very involved with all of it. And so I have fielded calls from parents. I've sat here in my office with students. involved and not involved that just want to voice their opinion, and I'm here for them. So I definitely see a bit, like I said, a divide, and I would love to have some ideas on, I mean, I would love to have just something that I can do to just bring everybody back together. But once again, we're early in this. I know that we will. We're a resilient town. I know that this school and the principal here, Brett Willie, he's phenomenal, and he's doing a great job at doing everything that he can to facilitate healing and moving forward in the right direction. So specifically on the issue that just happened this last week, since it's a big deal, we're trying to move forward and make sure that everybody's taken care of. So.
Thank you. Craig, what is substance abuse looking like on campus right now, or mental health?
You know, we came across this last week, vape with dabs. That's the first time I've seen it up here with actual dabs in it on campus. That student has been pointed out, and we're working with parents and that student and assistant principals to see what we can do on trying to change behaviors when it comes to that. So as far as everything else, there's a lot of pizza going around and stuff. So as far as abuse, I'm not quite seeing it yet, as I'm fairly new to the role.
Thank you. I'm wondering if the ESD might share, Stephanie and Chris, what are you seeing? Because when things move from a disciplinary violation around substance abuse policy to intervention, that you're our first stop.
Stephanie, do you want to go first?
Sure. It's definitely picked up as far as, like Officer Robertson was saying. I'm getting a lot of nicotine vaping referrals, more so than marijuana offenses on campus. Those students do tend to self-disclose that they either do use marijuana, but it's never on campus. They don't bring it to campus. And that's not why they're referred to me. It's typically nicotine, but I'm seeing a lot of vaping violations right now. It's taking up a lot of my time, which is absolutely what I'm here to do. So I'm excited to make that intervention. But there's been a few repeat students that I'm trying to work with weekly, and the violations are still happening. So it's been tricky. I think it's also just a combination. It's been a really heavy time with the racist events that happened. And I think kids just are at that time. I mean, I can speak as a staff, like, I think we're all ready for maybe a little bit of a break, like just a 3-day weekend. You know, we've been going pretty hard since school started in Labor Day. And I think I'm just seeing kids getting a little worn out in a lot of different ways. And because of the subject matters we've been dealing with, it's just been a bit heavy. So luckily, we haven't seen much more as far as substance use on campus, much more than nicotine here or there, like maybe like an empty dab pen marijuana offense, which is still brought to our attention. But like Officer Robertson was saying, just that one as far as it actually being here, which, you know, coming in the end of November, it's not terrible, not great, but yeah, just sort of seeing a lot of like repeat offenders for vaping. So it's been a bit frustrating on that end, but, you know, I'm happy to make that intervention because we're not doing the same discipline policies. So as far as that's sort of where I'm coming from this week. And I think everyone's kind of looking forward to just like a little bit of a reprieve break. I think the kids are just starting to get worn out.
Yes, thank you. And then just so the coalition's aware, I don't have the data in front of me, but I know the data. So it was an issue that the coalition had been tracking for a number of years. In 2018, we did not see an increase in vaping, or at least not the same increase in vaping that the rest of the state saw, but that's partially because our students were using at much higher rates to begin with. And so where we had significant reductions in marijuana use, alcohol use, binge drinking, in prescription medicine use, and prescription opioid use. So we saw reductions across the board. The one area where we didn't see a reduction was in student vaping. So at Monroe High School, what we know according to the most recent data, and that was 2018, is that about 1 in 4 students self-identified as using vape devices. So I'm very eager to see what our new data will say. The school district wrapped up healthy use survey for this current year about 2 weeks ago. So we'll have new data beginning in the end of March or April, but this is an area where we continue to track. So, yep. And then the other thing is I did follow up with our risk management officer about a week ago to see at what rate we're experiencing substance use policy violations. And we are lower than in 2019, the last full year that we were in school. So like Stephanie said, we're definitely seeing these, but we're seeing it at a lower rate than we normally would compared to pre-COVID time. So kind of good news. But again, yeah, lots of heavy issues. Jury, anything to add from the ESD's regional perspective?
Nothing substantial. I would say that every district we interact with is experiencing almost exactly the same thing in terms of substance abuse. Rates are not high and not elevated as far as we can tell, but kids are worn out, and it feels like every bit of discipline and every bit of use is maybe under more observation and feels more grating to them than it would have otherwise, which is fine. I don't think we're in a position where we need to make things easier, but yeah, I'd say overall Monroe is aligned with everyone else, and the sky hasn't fallen. Like, our kids are doing fine, at least in the substance abuse area, and they're going to get by. We just need to continue being there the way we have been. So that's what I can say.
Thank you. And now I can't see if Wendy Burchell is still on with us. Wendy, if you're there, could you give us an update about what's happening across the region with regard to your work at the health district? And I'm wondering if you'll also tell us a little bit about the suicide prevention task force. And what
I'm still here, Joe.
Woohoo!
I'm here. Well, the suicide prevention task force had a meeting this morning, and I just that was kind of the introductory question they asked the group was, how's everyone doing? Like, what's going on? And the people that spoke up first were our school district folks, and they used kind of the same language you've all expressed here. It's heavy. They're seeing a lot of heavy stuff happening. Like, the kids are okay. Not a lot of suicide ideation, trips to the hospital, that type thing. But just they're ready. They said they're calling it their May, November, because they're feeling like they do in November. So, and I mean, as a parent of teenagers, I feel it at home. So I definitely empathize with that. So other districts are feeling that as well, definitely. I don't know if you've shared a lot with the group about the Youth Suicide Prevention Task Force. Okay. Well, back late spring, early summer, the county, Human Services, and the Children's Wellness Coalition decided to address youth suicide by forming a youth suicide prevention task force. And I'm a co-chair along with Joe and Natalie from the ESD, and then Liza Patchen Short from the county are all co-chairing this committee. And we've kind of come out of the gate running. We've come up with a lot of good activities, goals, and I don't want to take up a lot of your time, but I can just briefly go over kind of our priority areas that we've identified and some of the things that we're already doing and we've already done. We have separated into kind of 4 target areas, and then those 4 target areas have their own small work groups. So the first is the communications and community engagement team, and that's my group. So we're basically, that is what it is. We want to engage the community with talking about youth suicide, educating the community about youth suicide. September was Youth Suicide Prevention Awareness Month. There was a media release that went out talking about the task force. And again, kind of highlighting all the work that we're going to be doing. This morning, we just decided that my group's next task will be to, we identified a need to really promote in detail crisis services in our community, because we all hear and we all see, and I'm myself included, you know, here's the crisis line, call the crisis line. Well, we're so lucky to have this resource here, and a lot of people don't understand that could be an excellent way to be the first point of interaction with a youth or anyone who's struggling with suicide or mental health issues. So the example was, there was a student support advocate who had brought a student to the ER and waited 10 hours just to get medical sign off to go to a different facility where they didn't have beds. And then the person from VOA in the group said, you know, you can start with the crisis line, and we know who has beds. We know where the wait times are. So they have this whole expanded sort of service that I don't think a lot of people are even aware of. So we decided we need to promote that and put that out there. It's not just for somebody who's experiencing an immediate mental health crisis. They are a true resource for us in this community in regard to all mental health services. Outside of actually receiving treatment, they're good about that. So that's one of the things we're going to be doing in the next month in regard to my group. The other focus areas are adult training. They want to increase capacity and competence of adults to respond to youth in emotional crisis. So that's going to involve community trainings. We're going to be working on that. They've identified week-long trainings they're going to start doing in February, and that will be evidence-based practices, AFSP program called Talk Saves Lives. You'll hear more about that coming up in the next month or so. And then trainings specifically for physicians and medical staff on, you know, the Department of Health guidance, protocols that some clinicians have in place that are working, and other facilities might not have any mental health protocols in place, just kind of so everyone's on the same page. Then the third focus area is school engagement. That's Joe's group. If he wants, he can talk about that. I don't want to, because he's been meeting separately from us. And then the last focus area is intervention and treatment. So how can we increase access to treatment services in our community? So we're busy. We're doing a lot on that. And I actually have, my group was tasked with creating a help seeking, like a flyer. And we did create that, and it's in 6 languages. You are all welcome to that. I'll put my email in the chat if you want to drop me a note. I can send you the files that you can print at your agency and just post them everywhere. If you want specific languages, you can ask for those. I'd be happy to share those. That was the point of that. So we've got those ready to go. Other than that, as far as my work goes, I'm also the child death review coordinator in the county. And that's how we determine what I work on based on the data from child death review. So youth suicide is obviously a priority area. However, I'm preparing for our December meeting where we're going to be reviewing infant deaths, and we've had more than double the infant deaths that we've had youth suicides in our county. So that's very concerning to me and to those of us working in that topic area. I know that's probably not something this group talks about or works on. And that's also something I want to talk about on a larger scale with the partners I work with. Is I don't think people realize that this is an important issue in our community. We're losing babies in unsafe sleep environments in our community at higher rates than we're losing our kids to suicide. So that's something we need to focus on. So that's the other half of my work as far as injury prevention goes. So that's a lot. I don't know if anyone has any questions. I'll put my email in the chat. So if you want those flyers, drop me a note.
I had a question.
Yeah.
And so at our church, and I'm pretty sure of several other churches, there are a lot of youth groups there where there's leadership that could benefit from this kind of training. So you mentioned it would be in February or?
Right.
Because I feel like, at least from my point of view, this coalition has done such an awesome job of like suicide prevention in the schools. I've benefited as a parent from things being flagged for what my kids have said. But I just feel, at least we had one story where we have an early morning seminary class and about, I would say 100 kids out of 3 different congregations attend. And one of the teachers had come to an adult meeting that Joe led, and he just had some resources, things to ask. I think he might've even had a survey, and the teacher just gave this, to the teenage kids and was so shocked. So I feel like there's like an awareness, and this was pre-COVID, right? So totally floored pre-COVID about how many students were struggling in her class. And so I think there's just maybe an opportunity in the community faith-based wise, or maybe even like Boy Scouts, where we have interactions as leaders with these kids, even maybe more so than they do at school, because it's smaller groups and we're there with them a lot. So my question is just, how do I get these resources that I think are so well integrated into the school system, maybe into our community a little better with these people who are working with these youth? I mean, parents, but like, these youth leaders and teachers who are with them a lot, who could really benefit from just knowing signs, maybe even anonymous survey, how is everybody feeling, those kind of things, but where to point them. Because I think she was shocked by who's struggling, but then she didn't have like the crisis line or those other pieces. So I would love your flyer. So I'll take in your email, but what was your February details? You have those yet?
Well, we don't have those yet. So, but you'll be happy to know, I'm glad you brought that up, because that was exactly what the education training folks talked about at our meeting this morning, is those are the exact groups they want to target. And the co-lead of that group is Greg Canahan. I don't know if you know him, he's in the community. He brought up faith-based groups first. So my question from the communication standpoint is, my suggestion was, I want everyone to be educated on this, obviously, but we really need to target areas as we come out with this, so that the 4 or 5 of us working on it aren't completely overwhelmed. So faith-based groups were the first on the list for that. So that's definitely what we're thinking is to, and then we talked about school staff that aren't teachers. So like just the bus drivers or just the para educators or, you know, other and YMCAs, Boys and Girls Clubs, very specific areas like that we're going to target. So, and I'll let, you know, Joe will be involved in all that communication so he can share that with your group when it's available too. So.
That's awesome. Thank you so much.
Yeah.
And then just for background, Greg Canahan, who's leading the education group, he's a retired pastor. So he has a unique perspective to bring to the faith community. So, and I can't see anybody else anymore. I only see 3 people on my screen, but I know I'd love to hear from Julie, and I'd love to hear Kimberly. Like, what are you guys seeing? Kathy Jackson, what are you seeing? And
I'd like to say something. Can you hear me?
Yes.
Okay, this is Julie. Sorry, I just wanted to, I'm so glad that I attended this because this is such a great outreach. You're talking overdose and suicide and mental illness. And I'm so on the other end of loss of life to all of these. And I know we're peer led, so I cannot support under 18 years old, but I can definitely support the parents and the grandparents after the loss of a child, because it changes the dynamics of the family forever. You'll never the same. And so I'm, you know, a bereaved parent. I lost my son to a drowning, but I know there's such a need. And I'm trying to get a hold of counselors in, you know, the Monroe School District, because they know bereaved parents that have lost a child, and just to get a hold of counselors because they have to educate the students, the survivors of these children that are lost. And that's what I'm here to do, to support them and to give them resources and that they can find joy. And I'm just a living testament because I've been on this journey 17 years. So this is great. And it's a great resource. And I can't get everybody's email, but I would love to share what the Compassionate Friends does to support the bereaved community. So thank you.
Thank you.
Thank you, Julie. Can you put your email in the chat as well?
Of course, of course.
And I guess update from my end with the elementary, middle schools, kind of the same thing you see in the high school. The behaviors are kind of off the charts. I mean, kids spent a year and a half in like maybe less structured environment, and then they're coming in not only behind the gun trying to catch up on learning, but also catching up on emotional behaviors. And so it's been really hard, and it's hard for the school staff. They're feeling a lot of pressure to just support these children in their behaviors. And so, like she said, the spring break can't come soon enough, and I think Christmas is on its heels where we'll need that break as well. Right now we have, I am so blessed in my position. I'm a family engagement liaison, but I also have a lot of resources in the community, and people are asking me, how can I support your family? So I have right now up to 60 children or families will be supported through the holidays by different groups. And so I am just really thrilled that that we have such a giving community and that they really wanted to do something, reach out. So glad to be here.
Kimberly, what are you seeing at your end? Are you still with us? Maybe not.
Can I just say one more thing?
Oh, please do.
Just during the last 18 months, we have seen a rise in overdose and suicide amongst our young, because they can't get out and get to their support, you know, in school and their friends. So we have seen a rise in loss of life due to overdose and suicide and mental illness amongst our young. Very sad, very devastating.
Anybody have anything to add? We're approaching the last 5 minutes.
I would like to add something. Thank you for everyone who has brought their perspective on where things are at in our young people. That's what this coalition is all about. Coalition of Health for Healthy Youth. And also, I wanted to make sure everyone remembered that this week is the Police and Fire Appreciation Week. The last 20 years, we've supported and created an atmosphere in our community of a week-long, right before Thanksgiving, a week-long time of honoring and thanking our police and our fire first responders, Monroe. And also the next meeting is December 9th, right, Joe?
That is correct.
All
The
right.
Thursday of December. Well, okay. I mean, Pastor Michael, you're a good case in point on what I can actually see. I can only see your forehead. So, and now I see. So this is really bizarre for me. Anything before we go? And if nobody else wants to share, Tom, I'm wondering if you could close us out with some words of wisdom.
Well, I thought that Pastor Michael did a great job of kind of summing up the importance of who we are, and we had a great cross section today of our community, and it just gives a great picture of what's going on. I grew up in the Vietnam era, and I saw just the other day, I saw a bumper sticker that said the Vietnam Navy vet. But next to it, he had, and I hadn't seen this before, I think other people probably have, everyone gave some, all gave some gave all. And I was teaching at that time in Montana, and we buried 7 of our students from Vietnam. And so, you know, it was just powerful to put those two pieces together. All gave some. And that's what the coalition is, all give some, you know. So thank you all for being here, and how blessed we are to have Joe as our leader. He pulls it all together. So thank you, thank you, thank you.
Well,
Amen.
hey, you guys.
I was supposed to say hi from Carrie Boone. Sorry, just for those who know her. He's like big hugs, big hello to everybody. She misses the coalition. She's almost in her house before December 3rd or 1st. I think they'll be in their house. But yeah, she misses.
Thank you.
Thank you. And if today was your first time, Julie, Sharon, Derek, I'm so glad you're here. Like, this is a great time to hook up with us, because we are literally about to plan the future, at least the next 2 years of where we're going to focus our efforts.
Awesome.
I'll reach out to
you.
you and let you know what we are. We're a primary substance abuse prevention coalition, and what that means and how we branch out to other areas, including suicide prevention and mental health promotion. So
Awesome.
thanks for being a part of this.
Thank you for all you do.
Oh, thank you. So I can't stop recording or anything, so I have to end the whole thing. So I'll see you guys.
Thank you.
Here.
Happy Thanksgiving, everyone.
Happy Thanksgiving.